Iclusig is used to treat certain types of blood cancer, chronic myelogenous leukemia, acute lymphoblastic leukemia. Active ingredient ponatinib. It works by slowing or stopping the growth of cancer cells. It belongs to a class of drugs known as kinase inhibitors. Indications. Iclusig is a prescription medicine used to treat adults who have chronic phase chronic myeloid leukemia, who did not tolerate or no longer benefit from treatment with at least 2 prior kinase inhibitor medicines. Accelerated phase or blast phase CML, or Philadelphia chromosome positive acute lymphoblastic leukemia, who cannot receive any other kinase inhibitor medicines. A specific type of abnormal gene chronic phase, accelerated phase or blast phase CML. How to use. Take Iclusig exactly as prescribed by a doctor. Follow directions on the prescription label and all medication guides or instruction sheets. Your doctor may occasionally change your dose. Iclusig is usually taken once daily with or without food. Swallow the tablets whole, do not crush, chew or break it. You may need frequent medical tests to be sure this medicine is not causing harmful effects. Your cancer treatments may be delayed based on the results. Usual dose for chronic myelogenous leukemia, chronic phase chronic myeloid leukemia, initial dose 45 mg orally once a day, upon achievement of 1% BCR-ABL1 or less. Standard dose according to international scale, 15 mg orally once a day. For loss of response, re-escalate to a previously tolerated dosage of 50 mg or 45 mg orally once a day. Contraindications. You should not use Iclusig if you are allergic to ponatinib. To make sure Iclusig is safe for you, tell doctor if you have ever had heart failure, high blood pressure, heart rhythm problems, long quad syndrome if you are a family member, a stroke or blood clot, diabetes, high cholesterol, liver disease, bleeding problems, lactose intolerance, tablet may contain lactose, pancreatitis, or if you have had surgery within the past 2 weeks. You may need to have a negative pregnancy test before starting this treatment. Ponatinib may harm an unborn baby. Use effective birth control to prevent pregnancy while you are using this medicine and for at least 3 weeks after your last dose. This medicine may affect fertility, ability to have children, and women. However, it is important to use birth control to prevent pregnancy because Iclusig can harm an unborn baby. You should not breastfeed while using Iclusig and for at least 6 days after your last dose. Warnings. Iclusig may cause heart or blood vessel problems that could lead to heart attack, stroke, or death. Call a doctor or get emergency medical help if you have chest pain, spreading to your jaw or shoulder, shortness of breath, dizziness, severe stomach pain, swelling in your legs, sudden numbness or weakness, headache, or problems with vision or speech. Iclusig may also harm your liver. Call a doctor right away if you have upper stomach pain with loss of appetite, dark urine, bruising or yellowing of your skin or eyes. Side effects. Get emergency medical help if you have signs of an allergic reaction to Iclusig, hives, difficult breathing, swelling of a face, lips, tongue, or throat. Iclusig may cause heart or blood vessel problems that could lead to heart attack or stroke. Call a doctor right away or get emergency medical help if you have heart attack symptoms, chest pain or pressure, pain spreading to a jaw or shoulder, feeling short of breath, signs of a stroke, sudden numbness or weakness, especially on one side of the body, sudden severe headache, slurred speech, problems with vision or balance, signs of a blood clot, severe stomach pain, pain or swelling in your arms or legs, coughing or blood.